In the previous class we have discussed up to the skin bathing, and also the last is perineal care for the males and females. In that, very importantly, menstrual hygiene care we have done, right. So, female perineal care, after that we have to do the post procedural things now. That is why we are getting into the post procedural part. Now, in this complete care, what we have to see, in the pre procedural, in the intra procedural we have done much, and in the pre procedural we have said that we have to remove the gown before doing any complete bed bath care. If you want to give, we need to remove the gown, right. Then only we can expose the body area, and also we can do the care for them, right. Now, how you have to remove the gown? We said that you have to remove first non-IV site arm, and next you have to remove the IV site arm with the precautionary measures like lifting the IV bottle and that passing it through the outer surface of the sleeve into the inside of the gown. So, this is how we are removing the hand and drip set and drip the tube, overall the IV bottle you are removing from outer aspect of the sleeve to the inside of the gown, right. Now, that is for the second step, is to remove the IV site arm. That is for second step there. First important priority, you need to remove from non-IV site arm. Here we are wearing the gown after the complete bath of bed bath care. We have provided everywhere the rinse it and pat it, dry it, everything we have done. Now, the patient is prevented from the chills and all, but we should not keep the patient as it is, like exposing overall the body. So, that will also makes the patient to have a complication like hypothermia. That is why we need to put the IV bag and also IV bottle or IV bag and IV line drip set inside the sleeve, where we can say outside of the. So, we have to insert the IV bottle from inside of the gown to the outside of the sleeve. Okay, we need to pass it through the sleeve from the inside of the gown to outside of the sleeve. Okay, why we have to do that? Because we are wearing the gown, we are not removing now. So, while you are wearing, that time while you are making the patient to wear, that time first priority for the IV site arm, not the non-IV site arm. Okay, first IV site arm, wear that carefully by passing the IV bottle and arm from the inside of the gown to outside of the gown through the sleeves, right. So, that's what the first step it is telling about, right. Next, second point, combing the patient's hair you need to do, and if the patient is unconscious, then you should perform the shaving for the patient, and if the patient is conscious, then you should the instruction should be given by the nursing officers that. So, ask the patient, instruct the patient, can you able to do yourself shaving? You need to ask that. So, why we have to ask? In order to make the patient, in order to make them as a promote them their self esteem, okay, and to make the patient to be accountable and sense of well-being. Okay. For that purpose, we are permitting the patient, and we are asking the patient, and we are instructing the patient, and when you are telling that, if the patient ignores to do, and that time you should do that. Clear? So, we are asking, we are taking an accountability of the patient. That means the patient undergone OT operations, or the patient undergone unconscious, he may gone through with like between the thin line between the death and alive. Okay. So, in that time the patient feels he was worthlessness, and in that time if you are asking them, he feels like I am also having some respect, or else they will feel that, so I will also have some self esteem, so that it will promote the self esteem, and they will promote it as accountable for as like every person, right. Understood this one? So, that is why we are asking the patient. If he can't able to, we need to understand his decision making, and we have to give the care if he ignores. Clear? Yes. Lower the bed. So, first what we have done, to ergonomic level we have raised the bed, and we have lowered the side rails before giving the complete bed bath, right. Now, the post procedural. Now, it is everything is done. We have given the gown also, to the patient, and we have given the blanket also, right. Now what we have to do, we need to lower the bed as like before, and we need to raise the side rails. Okay, very importantly, these two will confuse. Lower the bed, raise the side rails in post procedure. In the pre procedure, raise the bed, lower the side rails. Clear? And that should be where the point of care you are giving. That side you need to lower and raise the side rails. Are you understanding? Are you understanding? If the patient needs two assistance, that time you can lower the side rails on two side. Okay? Yes. So make an occupied bed as a it's a occupied bed, you need to make it, and observe for the comfortableness. Is that patient is comfortable, or else you need to give another position, you need to make sure. And is that patient is tired, or else is there any modification that we have to do, like in order to prevent the pressure ulcer and all. So that one we have to see. Later on we need to document it about the tolerance level, about the teaching, what you have taught while you are giving the patient care, bed bath. Okay, and after the post procedure also you need to tell that every 2 hourly we will change the position, we are repositioning you, because we have given a moist warm water bed bath. Now it may, due to this moisture, even after drying it, so we can't able to dry it very roughly, we can't able to rub it, we have to pat it gently, right. So that's why we need to check for the tolerance, and also we need to teach them every 2 hourly we will come and change your position. If we able to do, then we have to instruct them, you have to change the position every 2 hourly, right. And we need to assess for skin abnormalities, because different nursing officers will do different because of their tensions or something else they have done. And in the post procedure we need to inspect all the body parts from the head to toe. Why we have to check? Because is there any ulceration? When we are rubbing, we have the conscious that we have to rub it very gently, but unfortunately we rub it very roughly according to the point of view of patient, right. So that's why we have to check all those things. Is there any irritation, or is there any ulceration, reddened, or is there any necrosis is happened? So that when we have to check in the skin abnormalities, and we have to document it. Clear? And where we have not given much care because of the skin abnormality, that one also we need to document it. Suppose that area is contraindicated, then what we have to do? So then you have to document it and apply any lotions or anything that as per prescribed by the doctor you need to apply. So this is about the what we have done. This is about the complete bed bath care, the procedural, post procedural points. Are you understanding? Yes, we have completed this one. Now we will get into the next one. Before going to that, so these are all images that I have been shown in the previous video itself. Yes, in the previous class we have done the 5th class in the previous. Now it is a, we will get into the 6th class. Okay, so before that, answer this question. While giving a complete bed bath, the nurse should support the patient's arm and wash it. How to wash? From where to where we have to wash? So option A, axilla to fingers. Option B, finger to axilla. Option C, elbow to fingers. Option D, in any direction you want. Option? How many of you say option D? D or B or C or A? B. Okay. So we have to clean from distal to proximal. Distal to proximal means wrist to axilla. That means you have to clean it from the finger. Okay, finger side to up to where axilla you have to clean. That means which is the right answer? Yes, B is the right answer. So axilla to fingers, if we clean, we are cleaning like most contaminated to least contaminated. Always do remember, we need to do from least contaminated to most contaminated area. Always we need to clean. And another rationale for this B option is, we need to increase the venous return, or else we need to promote the circulation. So that's why we are doing from fingers towards the axilla. Okay. Yes, good. Now tell me the second question. Okay, the most appropriate water temperature for the adult bed bath. Which one is the right answer? C. Okay, so 37 to 38 degree, this one is for the children, or else we can say infants. For them we will do the bed bath. No, not like that. We are on the laps of the thighs of the mother or father, they will do bathing, right? That should be what water temperature they are asking. So for them 37 to 38 degrees Celsius, please keep it in mind. For them I am telling about the warm water. Are you understanding? Warm water for the children or infant is 37 to 38 degree for the children. For the adult, they are asking adult, no. So that one I already said, that is answer is 39 to 41 degree Celsius. This is warm water. Are you understanding? This is warm water for adults. Now hot water. Sir, you said about the warm water for the bed bath. Why are you telling about the hot water? It's a rationale, and I have to say that. Clear? Hot water bag application will give. Do you know this one? To relieve from the pain, to relieve from the congestion, to relieve from the retention of the urination. For that we are giving the hot water application. I am not explaining the full thing, but I am telling you the temperature. Okay. For the children, please keep it in mind, hot water means that is 105 to 115 degree Fahrenheit. Understood? And for the adults, hot water means 115 degree Fahrenheit to 125 degree Fahrenheit. Understood? Everyone understood? So this is for the hot water. Okay, this is for what? This is for hot water. Clear? Yes. We'll get into the next one. Okay. So before going to the nail care, we need to understand what are the some anatomical aspect of the nail, right? So this one we'll call as a nail plate. What we can call this one? Nail plate. Overall, this one will be called as nail plate. Clear? And this one is the edge, free edge of the nail, and we are going to cut the free edge of the nail only, right? And this, can you see this half moon shape, right, in the back portion? So this one is the lunula, what we can call lunula. Are you understanding? Lunula. So lunula, just before lunula, can you see this small dead skin? So this one we can call cuticle. What we can call? This one is cuticle. Okay, and this one will be called as the upper skin, and some tissues is holding the nail plate. It is held by upper aspect of the tissue and skin. That one we call epionychia. Always do remember, I will tell you. First of all, nail means, what is the meaning of nail in medical terms? That is onychia. Are you understanding? Onychia. Are you understanding? And n number of disease condition you can see, that is onycholysis. You can say onycholysis, or you can say coiloonychia. That means coiloonychia means spoon shaped nail. Okay, and some of the nails are clubbed nails. That one we will see in the which one we can see that clubbed nails? Cyanosis patient. For the cyanosis patient we will see clubbed nails. So if it is like this, okay, that one will be called as clubbing. If it is like this, then we can call it as spoon shape. Spoon shape is coiloonychia, and this one clubbing itself. Clubbing we will see in the cyanosis, and coiloonychia we will see in the iron deficiency anemia. Iron deficiency anemia, most common anemia. Clear? Are you understanding? Yes. Now, sir, why are you telling about the disease condition and anatomical aspect? Because if we are giving the care for the nail, we need to know what is the aspect of anatomy and what is the aspect of the disease condition of this nail, right? Are you understanding? Yes. Some of the labeling is not correct. What I am telling, that when you listen properly, okay? Yes. Can you see this proximal nail bed? Okay, proximal nail bed, on the top it is holding, that is called onychia. What you can call onychia, where it is, you can see if it is there. Epi, they have written onychium. Okay, onychium. Are you understanding? So this one is above, a thin layer, but cuticle is different, onychia is different. Cuticle means dead tissues, and that one which is holding the nails, okay, this one, living cells. Living cells will be called as onychia. Dead cells which is there after that and before lunula, it is called cuticle. Why I am stressing this one? Nail care, it is very important to know about the cuticle, that's why. And below the nail bed, there is a below the nail there is a nail bed, okay, and it has been this nail plate is inserted inside fully at the proximal level, okay, and where this one is onychia, and this nail is still inside up to here. Are you understanding? And this one we call nail bed. Are you understanding? And this nail bed, if it is separated from the nail, we call onycholysis. Why I am telling this one? If the nail plate is separated from the nail bed, that is called onycholysis. If it is infection, then we can call onychomycosis, okay, like that fungal infection and all. So in all aspect I can say onycho means what, onychium means what, that is nail plate. Everyone understood this one? And how we have to prevent this one? By giving the nail care to the patient. I hope everyone understood these things. And here it is wrongly they have given, this is called free edge, and this one we can call as cuticles. And cuticle dead cells you can see here, and this one is the dead cells, okay. What is this? Dead cells. And we need to remove that, and we need to not remove like from inner aspect to outer aspect or proximal to distal, we should not clean. We need to clean from distal to proximal. That means we are pushing back. We are pushing the dead cells towards the proximal side. Are you understanding? So we are pushing back. Clear? Can you see like this? The direction I am showing. Okay? Understood? Yes. Now getting into the topic. Sir, what nail care, which one we have to give the care first? Are we going to give the care first hand nails, or else are we fingernails, or else we are giving care for the toenails? Which one is the first? Hand nails is the first. Sir, why sir? Because 0.2 mm per month it will grow. What is the rate of growth for the nail of the hands? That is 0.2 mm per month. And who is helping for the growth? Very importantly, please do remember, that is nail matrix. Nail matrix is helping, which is from the inner aspect of the onychia and hypoonychia. Onychia means above the nail plate, hypo means below the nail plate, and it is immersed inside. This nail plate is immersed, okay. And in that, the nail, overall nail matrix is developing the nail, not only the free edges, it is developing from the inner nail matrix, and it is developing from the inside to outer. You can apply you may apply the nail paint, and that will like we can say that is permanent nail plate you apply, and that will you can see that will move forward. First day you applied here, and after 3 days you see it will be little bit forward, right? That means nail matrix is developing from proximal to distal. Are you understanding that? Yes. Now, why we have to give the care? Why we have to give the nail care? Because so that when these free edges of the nails will be there, no, on either side of the nail also, that will get inside the skin, okay, and that will breaks the continuity of the skin, or else that will makes the patient, suppose he was a diabetic mellitus patient, and that will expose the inner aspect of the tissues, so that the bacterial invasion is very easy for that. Okay, so that what we are doing, we are cutting the nails. What is nail care? We are cutting the nails and we are washing around the nails. Clear? That's what the exactly for of the nail care. Are you understanding? Yeah, really? Yes. So first one, nail care includes the regular trimming and cleaning under the nails and cuticle care also. We have to push back the cuticle backside and soak the nails in the warm water, soapy warm water. Okay, soapy warm water for 5 to 10 minutes. We need to instruct the patient to soak, or else if he was unconscious, we need to soak that for 5 to 10 minutes and push the cuticles back gently, as I said. Okay, so like this we have to push back. Are you understanding? Yes. Next, fourth one, use the nail clippers to cut the toenails also. Now you have cutted, first you cut the fingernails and next you cut the toenails. Are you understanding? Yes. Why we have to cut? To prevent them from the growing into the skin. As I said, alongside it will enters into the skin. And very importantly, we have to make something like smoothening we have to done for the hand nails, fingernails. We should not do the smoothening for the toenails. Okay, why sir? Because you are attempting to do the cutting nails for the toe, that time there is a highest chances of getting break in the continuity or bleeding may occurs for the toe. So that time it will be exposed to contaminated area. Always the legs are in contaminated foot, right? So it will be daily you are walking on the ground, so that is contaminated itself, right? So that's why we need to give the care. While giving the care, make sure you should not make soft at the edges alongside of the toe, only for the toe. For the nails you have to do it. Clear? Yes. Observe the color and nail bed. So in order to observe the color and in order to observe the refill time also you need to observe. So at that time what you will do, and also you need to observe the bluish discoloration or yellowish discoloration for the jaundice, bluish discoloration for the cyanosis. You need to check. If you have done the nail paint, you need to remove it. Okay, if the patient has done the nail paint, you have to remove it. Then it is easy to give the nail care also, and easily to assess the patient's condition. Is that jaundice or is that any cyanotic? So you can easily identify. Next one, nail polish, if it is need, you need to remove to allow the monitoring like refill time, cyanosis, discoloration of yellow, that is jaundice. Clear? So first I know that you also know that first one is sclera for the jaundice to check yellowish discoloration, but along with the nails also very important, whether it is reached up to the peripheral level or not, for that we have to check. Okay? Yes. Now we will get into the eye. So we have done the nail care, we will get into the next one is eye care. So in the eye care we can see the outermost will be called as sclera. What you can call? Sclera. And this one we will call what? Choroid, right? This one we will call choroid. And inner yellowish color we can say that is retina, right? Yes. Now coming to here, so the sclera is covering overall the bulb of the eye cavity. Okay, outer aspect, it is a fibrous layer where it is covering outer aspect, but another which is continuity of that fibrous layer, the same fibrous layer which is having transparent, that is cornea. Okay, what we can call cornea, and this cornea is very important. Cornea is very important because this cornea is always exposing rather than, okay, the other like conjunctiva and all, that is not exposing much, okay, but this cornea is exposing every time to inspect, to observe, to have a visual field, sense eyesight, so that it is exposing, and that too for the unconscious patient. Sir, why are you telling that unconscious patient is exposing their eye cornea? Because normally we know that normal blink interval is 3 to 5 seconds. Okay, 3 to 5 seconds. Suppose now we have blinked, and after 3 to 4 seconds again we will blink. This is the normal phenomena, and it is like as like respiratory rate, that is 12 to 20 times per minute, not seconds I am telling. Interval is 3 to 5 to seconds, or else you can say 4 seconds. 60 divided by 4 is 60 seconds divided by 4 is 15. That means average is 15 and approximate is range is from the 12 to 20. 12 to 20 blinks is normal, and more than that is also okay, normal, but less than 12, or else if the patient is not at all blinking. Sir, which patient will not blink? Unconscious. And also coma vigilance will call. Coma vigilance, always they are opening like this. And for the one who is using the computer for prolonged period of time, like for their jobs, that one will cause always remain their eye to open. So that will cause us what? Sir, if we remain open the eye, what is the problem? What is there in that? Now, when you close and when you open, the tear will be produced by the, or else the lacrimation is produced by the lacrimal glands. And lateral aspect, the lacrimal gland is there. It will pour the tears inside the surface of the what? That is eye. See here, above the cornea, the another layer is there, that is called conjunctiva. And this conjunctiva is this one which is around the eyeball is called bulbar conjunctiva, and which is having the C shape, it is called fornix conjunctiva, and which is on the inner surface of the eyelid, that is called palpebral conjunctiva. All are conjunctiva itself. They are called bulbar conjunctiva, fornix conjunctiva, and palpebral conjunctiva. Are you understanding? And this one, if they remain open, that time they may cause conjunctivitis, and the infection and inflammation to the cornea, it is called keratitis. What we can call keratitis. So only 3 or 4 steps is there. I will complete within 5 minutes or 10 minutes it will take. So listen carefully, it is very important. Okay, there is a difference in the eye irrigation and eye care. Okay, so that one also I will tell you. Bulbar conjunctiva, fornix conjunctiva, palpebral conjunctiva, and all this conjunctiva, if it is infection occurs due to the remain opening of this eyelid, and they are not blinking, that time a computer eye syndrome, what we can call computer eye syndrome, or unconscious patient, they also remain open. That time infection occurs, conjunctivitis and keratitis. Keratitis for the cornea, conjunctivitis for the conjunctiva. Okay. Now, so in order to prevent those infections, we are giving the eye care. Now we need to assess the patient whether he was having any infections, like if there is infection, he may have pain, he may have redness, he may have swelling. Can you see this? Swelling is there, and pain, if it is there, we can't see, we can experience, and we can see the redness in most of the conjunctivitis we can see, and any like secretions, pus is secreting out, and if you are not cleaning it, and that will become hard pus, and this hard pus or else hard secretions itself called crust. Hard one, soft if it is there, that one we can call secretions, and if it become hard, then we can call crust, and you should not remove this crust. You should make it soft, and later on you need to remove. Sir, what happens if we remove that crust itself? That will make the injury to the conjunctiva or a sclera, and there is, if it is injury, then vitreous fluid, aqueous humor, everything is exposing outside, and it will also drains out. Are you understanding? So that's why we need to be careful when we are giving the care. Yes. So We need to apply the compress for 2 to 3 minutes or 3 to 5 minutes it is there. Okay, I will say in when it comes. Okay. Now procedure, first one, every procedure before giving the care or before assessment, hand hygiene is very important. You do the 7-step hand hygiene. Next, use the normal saline and also the sterile normal saline and also clean or as clean water with the sterile cotton gauze piece. Second point. Third point, we should not use the soap directly or else indirectly also we should not use. Indirectly also we should not use, directly also we should not use. Why? In order to prevent the irritation. Okay. And we need to give the position for the patient. Suppose she was unconscious, we need to tell we can't able to tell the patient, we need to make them side lying position. Okay, this is side lying position. Are you understanding? Or else we need to instruct the patient if he was conscious. Why we have to do and where we have to do and which patient and which eye particularly we are giving the care, that type we are, which one we are giving the position. Suppose the right eye is affected, then you should give the right lateral position. Or if it is left eye, then you have to give the left lateral position. And I am going to tell you, if you give right affected eye and you have given the left lateral position, what happens? Actually, you have to give the irrigation or you have to give the eye care from the inner canthus to outer canthus if it is irrigation. If it is ointment, that time also problem is there, I will tell you. So here you have some channel that will connect to the nose, okay, and this lacrimal duct, okay, this lacrimal duct, nasolacrimal duct we can call NLD, okay. This nasolacrimal duct, so if you are giving such position, all the it will drains into that pore and that will causes the infection also later. Whatever you have washed here, that will enters there and it may cross the nasal bridge also. It may cross the nasal bridge and it can cause the infection to this eye. Are you understanding? That's why we are giving the position according to their affected eye. Sir, suppose if the both eye is affected, that time also you should give which eye care you are giving, that side you need to give. Okay, suppose left eye care you are giving, give the left lateral position. Are you understanding? Yes. Now, so that is the fourth step. Next, fifth step. So dampen the cotton ball with warm or normal saline. First you need to dip it in the normal saline and dampen from the where to where you have to dampen. Wipe it out from the inner to outer. See here, you are wiping. First you are cleaning. Why we have to clean? Because we are not making the patient to get infection. That's why we are wiping from inner canthus to outer canthus. And this to be done only with one stroke. Suppose you have taken one gauze piece, you have to stroke it one time and discard it. Take another gauze piece and dip in the normal saline or prescribed solution. Not here we are cleaning, that's it, right? Dip in the normal saline and clean it from the inner to outer again. Clear? And in the case where we have to discard, please note it on the image as generated as red bin. It is not red bin, you have to discard in yellow. Okay, not in red, discard in yellow. Next, using a new swab, and each stroke you have to take it a new swab. That's what they are saying. Okay, next one, ninth step. And turn the patient for the another eye care. You have to turn that side. First you have turned it to the left side and you have given the left care eye care. Now you have to give the right care. For that you turn the patient on other side for the other side of the eye care. Clear it? Yes. And next, wipe it, or if you can't able to wipe it, then you have to apply the, you need to apply the compression, that you need to apply the compress, that is called wet warm compress. Wet warm compress you need to apply on the eyelids. Why we have to apply? Because this wet warm compress, that will makes your crust too soft. This hard crust is there now, that will become soft, and later on you can easily remove. Don't attempt to remove the hard crust. that will makes the injury, right? So the last point also I said, remove the compress and gently wipe the, again you need to remove the crust, no soft crust, that's why you need to wipe it from inner to outer. This is about the eye care that before procedure you have to give, okay, before procedure, or else before to prevent the contamination, to prevent the cross contamination, to prevent the infection, you have to do this one. And don't attempt to give the another eye care, that will cross the nasal bridge. Clear? Yes. Now the last thing, apply the eye drops by pulling the lower eyelid, okay, pulling the lower eyelid, and put the eye drops as per prescription. First you put the eye drop, second you need to apply the ointment if it is prescribed, okay, and tell the patient before applying, pull the eyelid, lower eyelid, and tell the patient to look upward, and on the lower eyelid you need to put the drops, and on the eyelid only you need to, from the inner canthus to outer edge of the eyelid you need to apply the ointment. Clear? Understood? And tell the patient to close the eyes if the patient is not able to close. If the patient is not able to close, then use this protective eye shield only for 5 to 10 minutes. Why we have to use only for 5 to 10 minutes? Sir, patient is unconscious, he remains his eyes open. That time we can apply this eye shield, no, to prevent the infection. You should not close every time, okay. So they have to blink, that means they have to close and open. Clear? So that's why you have to do this one. Are you understanding? And we need to give the care for the patient every 4 hourly, isn't it? Every 4 hourly we need to give the care as per the institution policy, that will differs, okay. Hereby we have completed the eye care, we have completed the nail care. Now we will discuss about the last 3 questions only. Tell me. Yeah, tell me. An unconscious patient has the absence of corneal reflex, okay. Which nursing action best prevents the exposure of keratitis? As I said, keratitis means corneal infection. So in order to prevent that, what we have to do? Which one is the right answer? Option A, clean every 8 hourly with the soap. Option B, instill lubricating drops and ointment and gently close the eyelids. Option C, irrigate the eyes with sterile water every hourly. And option D, leave eyes open for observation. Every time C. B. According to you, it is a B, right? So option D, why it is not correct? After applying the lubrication, after getting the infection, we have to clean it and we need to tell the patient to close, right? So every time we should not leave it open for observation. It is not good, right? So option D is wrong. And coming to the C, irrigating every hourly. Everything you are giving the moistening, then it is also wrong, okay? Not every hourly, eye care is every 4 hourly. And here every 4 hourly we have to give, every 8 hourly they are saying, and that too with the soap. That is, 2 things is wrong. One is 8 hourly and another one is with the soap. That's why option B is correct, and the eye care is done with the lubricating drops and ointments, right? Yes. Next, second question. Last second question. During eye care, the most important reason for using a new swab for each stroke. Each stroke we need to use new. Why? Save time. To save time. Actually it is wasting of time, right? Or else we are consuming the time. Sorry, not wasting time, we are consuming the time. Option B is improving the lubrication. To improve the lubrication, you need to keep it in certain temperature for the eye drops. Lubrication for the eye drops you are not using here, okay? And to prevent the cross contamination, of course, it is the right answer. And to reduce the eye irritation, you should not use the soap, okay? You should not use the soap, not the normal saline each stroke you are doing. where what irritation you will get with that, right? And that too you are cleaning the eyelashes from inner to outer, you are not cleaning the inner lower eyelid, right? So option C is the right answer. Last one, very important. Tell me, which nail structure is primarily responsible for nail growth? Nail bed, hypoonychium, nail matrix or lunula? Nail matrix. Very good, that is nail matrix. Nail bed, you know, anterior aspect of the hypoonychium, and hypoonychium is below nail plate. Lunula is a half moon shape. Hereby we have completed the eye care, nail care and some of the important MCQs. Thank you for listening the class. We will end up this one, and in the next class we will do other things. This is the class 6th.